Hi everyone, assalamu alaikum. You're welcome back to my YouTube channel. I know it has been forever, but alhamdulillah, we're back with a kick, and that is Ismail saying hello to you. So what we are doing today, inshallah, I'm behind the camera, but I'll be with you guys shortly. So basically, Ismail has been suffering from secretion problems. He has some kind of fluid or mucus in his lungs that we're trying to clear. So I'm just about nebulizing him with some saline water and Ventolin nebules. So please follow up, watch and see what we're going to do, inshallah. So just keep watching. Let me adjust my camera a little bit. That's the nebulizer, that's Ismail. So I'm gonna, the nebulizer is always dismantled because of packaging, so I'm gonna assemble everything, and please keep watching. All right, let's get started. Hi everyone, so this is me. So yeah, this is how we're going to assemble. Everything has been disassembled, so I have to assemble from the beginning. This is where, now I taped this because the cap keeps coming off. So this is where the saline water and the nebules, the Ventolin nebules, will go in. This is the main engine. This is the mask. So there's a measurement where you put to the maximum. I hope you can see. So I'm gonna put I've got my saline water. So I'm gonna add in my saline water first. Just punctured a little hole on top of the saline water. I'm following the measurement. There we are. It's almost to the maximum. I'm stopping here. Then I'm gonna add the Ventolin in it because his chest is really congested. You can hear from the way he breathes. This has been an ongoing issue for a while. So this is our Ventolin nebules 2.5. So we're gonna add everything in. Yeah, so these are 3, but I have to cut and get only 1. I just need just 1, and that's why I'm diluting, because it takes almost, so I hope you can see me, you just snap the top off. That's it, that's all. So it's open. I'm wearing gloves because everything you have to do with these kids that are special, you really need to take sanitization and hygiene as a topmost priority. So there goes the Ventolin, in goes there. I'm keeping this here, I will discard a little bit later. Now we have lots of attachment for this. Like I said, this is the mask. I'm gonna give it a little bit of a shake. This is the engine. Now the good thing about the engine is you have a place where you can just, I don't know if you can see me, where you can just keep your stuff like this and secure it safely before we attach the tube. This is the tube, it's quite long, so it can reach Ismail behind me. So I'm gonna attach the tube here to the engine and to the saline and medication. Right, so now we're popping the engine to the socket. All right, we're all set and we're going to start. I hope you can see us. We're going to start now. Now Ismail tends to get a little bit agitated because most of the times he doesn't like this on his face, but then, so a lot of times I end up, so that's the cough we're trying. There's a lot of secretion, and that's why he's coughing like that. So for the whole duration of the 30 minutes or 1 hour we're going to use this, I have to hold it because Ismail does not stay in one place. There we go. There you go. Sorry. There you are. So this is well secured. You can see, I don't know why it makes him laugh, but to him it seems funny. So, yeah, and there we are. So this is going to take a long time. I'm going to bring the camera close and make sure you can see what we're doing. I have to be behind the camera to check if you can see Ismail very well. Okay, there we are. So this is me holding it for as long as it takes. Now I'm going to use this opportunity to say one or two things to parents who have special needs children. Yeah, this is it. He doesn't stay. I don't know if it's ticklish, but it makes him really agitated. So sometimes what I tend to do is pull it off a little bit from his face. He still gets the benefit anyway. You can see the smoke coming out. It means it's working and he's getting the benefit of the medication and the saline water. So yeah, I wanted to use this opportunity to talk to parents who have kids that have neck paralysis or lack of neck control. What it does is, if a child has no neck control or fairly, fair neck control or neck paralysis, because some children do have neck paralysis, what you can do, and I'm sure most of the doctors will recommend you get a nebulizer, because when they're feeding, everything they eat on, seeps into the lungs, and if you don't check these things, this can lead to pneumonia, bronchial pneumonia. I cannot tell you how many times we have been admitted in the hospital with issues of pneumonia, from moderate to severe pneumonia. A couple of months ago we were on admission, it was the same pneumonia that took us to the hospital. So this is the only way you can dislodge the secretion in the lungs. Now there are therapy exercises. There was one I was taught in Egypt when I traveled to Egypt. There's a therapy that you perform to dislodge any secretion in the lungs. Inshallah, I'll make a separate video for that and I will share with you guys. So there's a therapy for that. And well, we live where you don't get all the necessary gadgets or tools that are necessary for these children. But I know there's a vest, a vibration vest that you can wear for a child, and it keeps vibrating the child until, sorry, let it out. So that vibration vest actually dislodges all the mucus or the secretion in the lungs, but we don't have it here in this country. I've never seen it, we don't have access to it. But alhamdulillah, this will suffice. We've been using this for God knows how long. Like, this has become part of our routine. Every morning and night we actually nebulize to dislodge all the secretion that is in the chest, in the lungs. Now, part of the reason why these children have secretion is because there's aspiration sometimes from food, from water, sometimes even their saliva, because Ismail tends to choke on his saliva. So that's why it's very important for mothers to know how to sit their babies or children with cerebral palsy appropriately when you're feeding the right way, to avoid aspiration. Aspiration simply means food going into the lungs, and we all know what that means. Imagine if you choke on your food or your water, you have to cough it out. You have to cough it out. So this is it. I decided to bring back my YouTube channel for educational purposes, and I'm doing this for educational purposes. Please, I am not advising you go ahead and start nebulizing your children with Ventolin. Now, the reason why we use Ventolin for Ismail, because I have a history of asthma in my own side, from my side. I have siblings who are asthmatic. I don't have asthma, but I'm a carrier. I have a tendency, I cannot stand, a place that is extremely humid and hot. And even during COVID, I wasn't able to wear face mask because I couldn't breathe. I'm not claustrophobic. I just cannot stay in a place that is not well aerated. So from time to time we use Ventolin. Sometimes it's just the normal saline water, but because he has some allergic issues, we use the Ventolin and Pulmicort. I don't have Pulmicort now, so we just stick with the Ventolin. It's okay for now. So yeah, I just wanted to share this information with you. Please Don't assume you know whatever you're trying to. I'm sweating because there's no light, obviously. We're on inverter, so the AC is not on, and Abuja is pretty hot. Sorry. So please, don't do anything by heart, as Nigerians will say, off head. If you have issues with your child having respiratory problems, because it's normal with children with cerebral palsy, respiratory problems are always an issue with children with cerebral palsy. Speak to your child's doctor. If they recommend a nebulizer, I don't know how much a nebulizer costs now. I bought this nebulizer almost 11 years now, because my first son was born asthmatic, but he's okay now. So I've had this nebulizer for over 11 years. He's almost 12, and I got it when he was 8 months old. So yeah, speak to your doctor, to your child's doctor, if you have any concerns that your child might be having some secretion in the lungs. Sometimes if it's very bad, there has to be some kind of injections. I know Rocephin injection is one of the injections recommended if it is infected, you know. But this will suffice if there's no infection, and the doctors are not really worried, you know. And when they listen to the chest, there's no crepes. There's what they call crepes. I think it's a creaking sound in the breathing of a child. So if there are no crepes, then maybe there's no infection, is not infected. But then if you're concerned, because why we do this every day now with Ismail is because he has been vomiting mucus for a while now, which is a source of concern, and we started a new therapy for him, a new therapy that will help him achieve full neck control, because if you don't have neck control, you will have issues with aspirations. They go hand in hand. So we started this new therapy yesterday. It takes a long time, God knows. It's not easy, but we'll get there. And inshallah, once I learn all the nitty-gritty of this therapy, I will share with you. But just so you know, some of these therapies are meant for your child's particular needs. Ismail has lost some of his ability to hold his neck. You know, once they fall sick, it takes them back. You know, whatever they learn, they unlearn. Sometimes it draws them back. But we're trying to go back to full therapy, intensive therapy now. And inshallah, once I learn all the steps of this therapy, I will make a version of that video and post it online. So please keep a date with me on my YouTube channel, as inshallah I will be sharing more educational, you know, videos like this for you on how to take care of your cerebral palsy children. Thank you everyone, and do have a lovely day. So we're going to finish off this off camera because I'm sweating. I'm sweating, you know, Nigerian factor, I'm sweating a lot. So we'll see you guys inshallah on the next episode of our CP diaries. Yes, this is a new chapter, revamping my channel, my YouTube channel. So it's gonna be CP diaries and, you know, home remedies to help your child and help you too. Alright everyone, stay safe out there and take care. See you on the next episode. Bye everyone. Buku say bye bye. Alright, bye. We're gonna continue this off camera now. Bye everyone.